Assalamu alaikum. Hello everyone. For those who are new to my channel, I have just started this channel to follow along the journey of my son Mohammed going through neuroblastoma, cancer of the nervous system, while having special needs. I would be talking about some of the challenges that we might see along the way that maybe a typical child might not exhibit. So let's just get started. Today I will talk about the protocol for neuroblastoma. Mohammed was diagnosed with high risk neuroblastoma. Standard protocol is about the same everywhere except for one hospital. There is a consortium of approximately 190 hospitals and research schools, centers, I guess. They follow a standard protocol. It's called COG, Childhood Oncology Group, and they share knowledge about childhood cancer with each other because some things might be rare, and that way more research can be done. Most hospitals will follow a standard protocol for high-risk neuroblastoma. It would comprise of 3 stages. One would be induction, the other one would be surgery, and the last one would be called consolidation. In induction, basically you get chemo, and then surgery is surgery, and then in consolidation it is high dose chemo followed by stem cell transplant, and then immunotherapy and radiation. So for us so far, we've done 3 cycles already. There are 6 cycles within the duration or the cycle. There are rounds, so that's number of days that you will get chemo. In Muhammad's case, the first 2 cycles were very identical. It had the medicines were topotecan and cyclophosphamide. In both cycles it was the same. One was administered for 1 hour, the other one for half an hour. So altogether in the day, only hour and a half of the day is chemo administration. Before that they give you, I believe, a steroid, and if anyone's going through this, for us, whenever the steroid was given, Muhammad threw up immediately. So we had to ask the nurse to go as slow as possible and do the flush also, which basically pushes down the medicine even slower through the tubes that go into his port. Make sure if you are going through it, ask that the steroid be given very, very slowly. That helped Muhammad at least to not throw up all the time. He's thrown up, I would say, altogether about 3 times with the steroid. And then after the steroid, they give you the medicine. Once the medicine's done, basically you get hydration, which is lots and lots of fluids. It's very, very rapid. Muhammad is in diapers, so we would be changing diapers about every hour, sometimes less, sometimes hour and a half. It would be very full. When we change diapers, you have to wear gloves because chemo is coming out, and the whole point of hydration is to get the chemo out of your body after it has affected or done the necessary work that it has done. It should not stay in your body. It has to be flushed out, otherwise your vital organs like kidney and liver again can get impacted. So the first 2 cycles were like that. Third cycle is with ifosfamide and carboplatin or cisplatin, depending. Majority of times it would be cisplatin. In our case it was carboplatin because cisplatin can affect your hearing, and Muhammad is nonverbal, so having another disability would have been very challenging for him. We've had amazing doctors who are understanding and really analyzing and giving the quality of care and treating Muhammad individually. When these medicines are given, they're given, one is 2 or 4 hour each, and then the other one is for 2 hours. And every 3 hours before and after every 15 minutes, I guess, before one of the meds, you have to get another medicine called Mesna. It's not a chemo, but it's to protect the bladder. It's given before 15 minutes prior to the chemo and after, and then every 3 hours for up to 12 hours. That protects the bladder, and also you, after those, it actually is 4 hours of chemo, but including the steroid and the flush and mesnite, almost took like 5.5 hours of the day. And beyond that, it'd be again a lot of hydration, a lot of diaper changes. If they're older kids, then it would be just using the restroom. We have 3 more cycles. We've done 3 so far. And once we go through those, I will talk about the medicines that we are given for those, and we'll go on from there. After the chemos are done, typically there will be surgery. Chemo is to bring you to remission or reduce the size of the tumor, cancer that is present. In Muhammad's case, it happened reverse. Muhammad's tumor was found so early that it was localized, and the doctors thought it was a low-risk neuroblastoma. But after the pathology came back, they found out that it was high risk. Generally, 99.97% of the times, if it is localized and it is low risk. Otherwise, if it's high risk, it would be spread throughout your body. And so high risk would go with high staging. Staging would be how many places and how far it has spread. Muhammad's at that time of in February is when his surgery was done, 2000, and it was nowhere other than the adrenal gland. In 3 months, he went from stage 0 to stage 4, and it was in his bones and in his bone marrow and some soft tissues as well. So potentially we won't do surgery because the surgery of the primary site was done already. For now, the standard protocol would be to do surgery after that, and then after surgery, it will be stem cell transplant. I forgot to mention that during the induction period, you will have the child will go through a stem cell collection. So once the stem cells are collected, there's I think they put like some preservative and freeze it until the second phase, the third phase, which is the consolidation. So basically they give you very high dose chemo. Generally the regular chemo that's given initially, your body can within 2 weeks can recoup and start making its own blood cells and try to get normal, whereas by 3rd week we do every cycle. For the first cycle, 6 cycles is 21 days, and by that time the body is relatively healthy enough to take another dose. Whereas for the chemo done right before a stem cell transplant, generally your body is in no shape, no form to be able to come back. There is nothing that your body can do to come back out of that after that chemo. It is very aggressive. They gave me a big booklet talking about all of that, and essentially the stem cells that were collected earlier rescue your body. It is quite aggressive. That they do 2 stem cell transplants. It's called a tandem stem cell transplant. It's deemed to be very effective in the last, I guess, 5 something years. It's increased the survival rate. The prognosis has gotten better because of tandem stem cells. And so that is what the protocol calls for. And after that, because there are 2 stem cells, you basically are in the hospital for 2 months because your body is still recovering, and it's quite involving. They've talked about the details of it. That itself could be a video. It's actually took 1 hour for them to explain all of that to me, but essentially it is very in my opinion devastating to your body, because if you don't have the stem cells, you won't be able to come back from it. But no one will give you this treatment if your stem cells were not collected ahead of time, and the chances of rejection are less because it is your own body stem cells, so very high chances that it will pass through just fine. But then again, you are in the hospital for 2 months for the 2 stem cell transplants. Once that is done, I believe you do immunotherapy and radiation. So immunotherapy is, there are various immunotherapy antibodies. There is one, I don't know too much about it, but basically there are antibodies that they inject into your body, and your immune system is trained to understand which one is a cancer cell, and then it targets the cancer cell and it kills the cancer cell. While it's targeting the cancer cell, it can also affect the healthy cell. And because this immunotherapy is for neuroblastoma, which is a cancer of the nervous system, these cells are attacking your nervous system. So you can have severe pain associated with it. I believe there are 3 cycles of immunotherapy. Again, they are 1 month long, and you are hooked up to morphine or some painkiller throughout that process. As much as I've been explained, this is not something that we've gone through yet, but that is what I recall. I could be wrong, but that's what I recall. And then after that, there is radiation. Now, I guess depending on where your cancer is, it could be, I guess, targeted, or it could be the whole body. I'm not sure. We are not at this stage. We are at the very, very beginning. So that's really what the protocol calls for. That is a standard protocol. I would really urge people to look at different hospitals. Majority look at COG, Childhood Oncology Group. Look at all the hospitals that are part of it. Chances are they're all following the same protocol, so don't bother really trying to go into the other hospital. They might have some changes here and there. Clinical trials might be different, but essentially the standard protocol is the same across the board. There's only one hospital that does not follow this protocol, and that is Sloan Kettering in New York, Memorial Sloan Kettering, MSK Kids, right? So they basically follow everything except for the stem cell. They don't believe that it is something that is gives you a better quality of life in the long run, and also that I believe they have, because based off of my reading and my understanding, they've pioneered a lot of immunotherapies, and they're quite, I believe, targeted and more effective. So research, do your research, see what you believe in. People who do stem cell transplant really believe in stem cell transplant. Personally, I just do not like the chemo that is before the stem cell transplant, because it is so aggressive. It does pass the brain blood barrier, so it is going into your brain, because this cancer can go anywhere, including your brain, and obviously your cell, it's going to go into your blood, so it can affect things. And we will see how things go. As I said, no decisions are made from our side. We will basically look at where Mohammed is after cycle 4, when the scans are done, and I'll keep you posted. If you have any questions, leave a comment. Thank you.